Thank you so much. So my name is Cate DeCarlo Santiago. I'm an associate professor in psychology here at Loyola, and I'm really excited to get to talk to all of you about one of our projects. And I have two graduate students joining me, and I'll let them introduce themselves briefly as well.
Hi, everybody. My name is Jolie. I am a fourth year in the clinical psych PhD program here at Loyola, and I'm one of Cate's graduate students.
Hi, everyone. I'm Roxanna Flores Toussaint. I'm a second year in the clinical psychology program and working with Cate as well. Excited to be here.
All right, we're going to be talking about supporting transition resilience of newcomer groups today. This project we're like living and breathing it right now. So we're excited to share, what we've done in the past and what we're up to right now. As we get started, I want to make sure to emphasize that this is a heavily partnered effort. We have partnered with Chicago Public Schools, and specifically within Chicago Public Schools, we're working with Office of Language and Cultural Education, as well as the Office of Social Emotional Learning. We are partnering very closely with the Center for Childhood Resilience at Lurie Children's Hospital. We also partnered with Refugee One, which is an agency that supports resettlement for refugees in the Chicago area. We also have partnered with the National Center for School Mental Health. They were the original developers of the intervention we're going to be talking about today. And then the Canadian Center for School Mental Health, same name, just center spelled slightly differently. We also have partnered with them. They adopted STRONG, the intervention we're going to talk about first, and piloted it in Ontario with Syrian refugees. This work would also not be possible without a pretty amazing research team. And this is our team, and we have actually expanded our team even further this year. And part of the reason we have a large research team is we're trying to be as inclusive in our research as possible. And when we're working with newcomer, refugee, and immigrant families, that means language capacity. So we are lucky to have recruited an awesome, diverse team with various language abilities: Spanish, Urdu, Arabic, English, and we'll talk more about that and our efforts to continue to expand. To give us some context, newcomer youth, so youth that have arrived in the US, come with a migration story, and that can look a whole lot of different ways. There's a lot of diversity in migration stories. So for some youth, we're wondering, what has led them to migrate. So the pre-migration context or stressors. And so for some refugee youth, that could be war, persecution, an environmental disaster, a man-made disaster. So those are things we're thinking about, the potential for high levels of stress and trauma exposure. And then they also have a story of how they arrived in the US, their actual in-flight migration. And for some youth, again, a lot of diversity in that process. But for some youth, that's another place where there's high levels of stress and trauma. It could include staying at a refugee camp or exposure to violence along the way. And then when they arrive in the US, there's also a resettlement period. And our goal is to offer support and positive reception during that initial resettlement period. And we believe that schools are a really important setting to offer that support. So refugee and immigrant kids and families often have barriers to accessing a lot of supports and services, but they are going to school, they are in schools, and that's a place that we can really offer some support. We know that newcomer youth are at risk for experiencing mental health difficulties because of some of the stressors I just spoke about. So some studies have suggested that refugees are up to 10 times more likely to develop PTSD than non-refugees. We know that exposure to stress and trauma predicts the development of PTSD and depression. And then when we're thinking specifically about the resettlement period, This is also a time where youth and families may experience additional stressors. So those might be financial or economic stressors. Unfortunately, a lot of our youth and families are experiencing discrimination. Um, there's also often separation from family left behind in a country of origin can be really difficult. Language barriers, depending on, how similar or different the US is to the country of origin, just adjustment to like, what is it like to go to the grocery store here versus country of origin, getting access to foods that you're familiar with. There's also changes in family dynamics and then adjustment to the different systems and norms in the US. So STRONG stands for Supporting Transition Resilience of Newcomer Groups. And it's a small group intervention that draws from cognitive behavioral approaches. And it was first implemented, as I mentioned, for Syrian refugee children in Canada. We piloted STRONG here in Chicago during the 2019-2020 year. That was also the year school shut down. And so we'll talk about how our pilot was very much impacted by COVID, but what we still learned from that experience. And we'll also talk a little bit about what we got to learn as a result of being able to follow up with some of our kids and parents during COVID. So I mentioned it's a cognitive behavioral school-based intervention. STRONG is 10 weeks, so 10 group sessions. There's an elementary and a high school version. One of the things I really love about STRONG is it does draw from the existing evidence-based literature in psychology on what we think would be helpful for kids who might be, have experienced trauma, might have some PTSD symptoms or not, might need mental health supports, whether or not they're experiencing significant levels of mental health symptoms. So it really draws from that literature, but also draws from the strengths-based literature, which some of our evidence-based treatments haven't done a great job of doing that in the past. And we know that our refugee and immigrant youth have a lot of strengths that have gotten them to where they are today. And then it's been contextualized to meet the needs of refugee and immigrant youth. So it's thinking about what are kids going through during resettlement and how do we use examples and apply these skills specifically to those kinds of experiences. It's really designed to enhance the welcoming environment youth may find themselves in their schools. So it does involve teachers and parents and enhancing those social supports. And then it also includes a journey narrative. So a journey narrative, if anybody is in the mental health field, you might be familiar with a trauma narrative and kind of trauma-focused interventions. This is a little bit different. So instead of kind of a really focused single event trauma narrative with kind of repeated telling of the story to kind of reduce distress as you talk about it, this is designed to be a lot more flexible than that and a lot more strengths-based. So recognizing that, some youth might not have experienced trauma on their journey. Some youth might have experienced multiple traumas. So focusing on a single event isn't a really good fit. And also, again, youth have been through so much and they've had a lot of strengths and supports that have gotten them to where they are. So we want to highlight those, build on those, and emphasize those strengths. So the narrative is designed to kind of tell a story of how they arrived in the US, while the clinician or facilitator, is asking questions about, and what got you through that part? Who was there with you during this part? And really bolstering a sense of like, yeah, I did get through this and I have a lot of strength and I have a lot of support around me. The inclusion criteria for STRONG are really broad, which is purposeful. So one of the things we wanted to do with STRONG is we wanted it to be an intervention that was relevant for kids kind of across the range of kind of mental health functioning. So some kids who have arrived, are, maybe distressed and having some trouble, but are not showing significant clinical symptoms. And we want to be able to support them so that they don't later develop clinical symptoms of depression or anxiety or something like that. So unlike an intervention where it's you have to have this level of anxiety symptoms or this level of PTSD symptoms to be in the intervention. We're saying you don't have to have a clinically significant level of symptoms. This is designed to really support any newcomer youth. We may, for someone who is highly distressed with significant PTSD symptoms, we may want them to get a trauma-focused intervention first. But other than that, this is really broad and open. And so any newcomer youth, and we've also been really flexible with time. So there's not like you have to have arrived within, 3 years or within a certain amount of time. It's really flexible to understand that resettlement really is a long-term process and there is a long-term adjustment. And so any newcomer youth are eligible. Exclusion criteria are just students that were born in kind of mainland stateside US. And then again, if they're experiencing significant symptoms, we may refer them to other services first. All right, Strong is 10 group sessions, like I mentioned before. This just gives you a sense of kind of the main focus of each of those sessions. So it really starts in session 1 with identifying strengths, inside strengths and outside supports. And then it goes through a number of sessions that help students understand stress, feelings, and then how to work with the stressful situations and feelings with, changing how they're thinking about things, problem solving, and then several sessions are dedicated to the journey narrative. So the initial journey narrative is done in a one-on-one session with the clinician and just one student at a time. But then in the group session, students share parts of their journey with each other and build that kind of community of support. I've been mentioning that Strong is a strengths-based approach. So I wanted to pull out just a few of the pieces that can kind of give examples of how this is embedded in Strong. So I mentioned session 1 is really the main focus is identifying those internal strengths as well as outside supports that students have. And then there's also embedded in the other sessions a lot of pieces that pull for kind of cultural identity and affirmation. So session 5, students share an object that represents where they're from to foster a positive cultural identity. Session 8, they share something meaningful from their home country, favorite food, special place. Session 9, they share about a favorite tradition or holiday. Session 10, they take turns appreciating the strengths they've noticed about each other, which is often a really beautiful session. And then again, the journey narrative pools for all of those strengths. All right, so our 2019-2020 pilot. We worked really hard to get this pilot launched here in Chicago. Like I mentioned, we had a large research team. We had to find, our core measures that were maybe available in as many languages as possible, but then we had to prepare long in advance to go through, a forward and back translation process for things that were not available in all of the languages we wanted to include. Same with consent. So, the IRB process of getting your consent approved and then having to translate it into 4 languages. It was a heavy lift, but we did it. One thing that I will note is, so we spoke to our schools, our community partners, and that's where we decided to focus on Arabic, Spanish, and Urdu as some of the most common languages spoken by the newcomer youth in the specific neighborhoods we were partnering in. Even with that, all that work up front, what are the most common languages spoken at your school, and getting all that information, doing all the work to prepare the materials in multiple languages, we still got families that spoke, other languages, and still kind of felt the pain of not being able to include, every newcomer family that was identified in a school. We have a very diverse newcomer population in Chicago, and there's probably countless languages that we could include. But it is something that we're trying to be really thoughtful about and always looking to expand. So, for example, we are hoping to expand our languages to include Dari or Pashto, which are the languages that the most common languages that Afghan refugees might speak, anticipating that there will be an arrival of Afghan refugees this year. We also worked really hard to collaborate with our Chicago public schools. So I said that we partnered with Office of Language and Cultural Education, and they really helped us select schools. So they had a sense of where the biggest newcomer populations were in the district and kind of facilitated a connection. And then we worked really hard to work with each principal and get the principals on board, and then working with the clinicians and often English language coordinators in the school who know the newcomer population. So I just emphasize how much relationship building was really critical to getting this project off the ground. We decided to do a mixed methods approach. We wanted to, in this pilot, really focus on initial feasibility and acceptability. We wanted to get a sense of impact with some of our quantitative measures, but really get in-depth qualitative feedback from its students and caregivers as well. We ended up partnering with 6 North Side schools, 3 elementary schools, and 3 high schools. So our research design included a baseline research survey, then kids would get the strong intervention, then they would get post surveys to get a sense of impact, and then we would do focus groups. So at the very start of our project, we had the strong training is a 2-day training for clinicians that are already working in schools. And we did our day 1, and then the next day the CTU strike started. And so our day 2, which was supposed to be that day, was delayed over a month, I think. So it wasn't the ideal training model to get like a day of the intervention and then a month passes and then you get the second day, but we went with it. And then we got going, and the intervention started for most schools in January or February, and come March, the whole world shut down. And we were like, this is just one crazy year to be implementing a brand new intervention. But we didn't give up. We tried to practice our flexibility and resilience. So we changed our plan for those post surveys. It was too tough to meet with parents at that point. And so we decided, let's just try to get, the student measures. And instead of focus group, we'll do individual Zoom interviews, and we'll be able to get that student survey during that individual Zoom interview. So we were really, I think, lucky and fortunate that the research review board at CPS was willing to, even consider letting us pivot and still talk to parents and students, but they did. And so we got an amendment in, and we're able to pivot and do a new design. So all kids did not get the full strong intervention. They were at most halfway through, but we still got some data from them about what they thought about the intervention that they got. And then we asked them about how they were coping with COVID. And by the time we did those individual Zoom interviews, it was a few months into kind of the school closures and the pandemic. So we want to celebrate that we got 29 students enrolled in Strong. We purposely made our consent forms, an opt-in to the different components of the research. So of those 29 students, 23 parents agreed to complete surveys for us, 22 parents agreed to do focus groups, 21 students agreed to surveys, 16 students agreed to focus groups. And then in the last column, you can see what we actually got. So really good at baseline with the agreement rates. We got almost everybody in. And then once COVID hit, we had a small sample of 14 parents and 13 students who we were able to follow up with. To give you a sense of how the groups looked across our 6 schools, it was 4 to 6 kids in a group. Top 3 are the elementary schools and then the high schools. So we had elementary through high school. Average age was about 14. We did serve more students who identified as male compared to female. And the average time that students had been in the US was about 2.5 years. About 53% of our students identified as refugees and 47% as immigrants. And you can see our race and ethnicity breakdown there. We had a really diverse group. So over 14 countries of origin were represented in our small sample of 29 students. The top 4 countries were Syria, India, Malaysia, and Guatemala.
And so for Strong, we recognize how important collaboration here was, and teachers were really key supporters in helping identify students that would benefit from the intervention. So they would work closely with the school clinicians to help recognize kids that could join the group. So overall, they noted for the kids that they referred in general that about almost 80% were struggling with some difficulties. And then you see the breakdown of what the teachers noticed. Understandably, academics is one of the top reasons for referral because teachers are seeing the kids day to day and seeing how they're doing in school. But you also see some other challenges for the kids that they were experiencing. So peer relation dynamics, which is understandable as you're possibly forming new friendships here. We also see some physical problems. So more of like stomach aches and somatization that kids are sharing with their teachers that they're experiencing. And also one of the key ones is family relationships as well. And our teachers also completed a questionnaire about student mental health functioning. And, you know, I want to highlight that overall, the students that participated in Strong were doing generally okay. But there are some key pieces where students were struggling a little bit more. And one of them that you see here is peer problems, which when you think about it is understandable given the new friendship formations that are happening and the potential challenges that could come with that. But for us, it was very positive to see that there weren't so many challenges identified. And then we also had our parents tell us about the resettlement stress that their children had experienced. And these are the top 5 stressors that parents noted from our list. So separation of family members in country of origin and the stress and concern that comes from that. And as you can see here, it was very stressful for about 43% of our students. Also, having to learn how to do US style daily activities, that may be a new adjustment for students. About 38% found that very stressful. There's also some of our students struggled to learn English, but about 40% did not. And then there's also the adjustment to expectations of and rules at school that could be different from country of origin schooling. And also that financial strain some families experience, and about 30% somewhat noted this is a stressor for them. And so as we noted, not everybody, well, no one completed the intervention, but we got about halfway through. So the most sessions completed were about 4 sessions in person and then 1 virtual check-in. And some of our groups schools only did 1 session. So maybe they finally formed their group, did their first session, and then had school closures the next week. For our bottom right, the high school there, I remember well that I met the last student to join the group March 12th, and then March 13th, we heard about COVID and closures. So unfortunately, they formed a group, but were never able to start any sessions. And based on the surveys that we were able to complete with students for follow-up, that did give us the opportunity to compare how students were doing before and after the intervention. Now, this is only with 4 sessions that we're seeing some differences. And so for us, we're very much thinking about some positives. What could it be if students got a full intervention, right? So we noted there was a significant change in overall those teacher reports of mental health functioning. We were seeing some improvements in that. Also, how students are coping. We noticed that there is an improvement in how they're doing that, as well as a sense of school connectedness. So we asked our students, how you feel you belong to your school. And after the intervention, students felt more connectedness and belonging. And we saw some trending significance about a change in resilience for our students. So here are some quotes that we want to share with you that students and parents spoke with us during our individual Zoom interviews. And I'll have Rox start us off with some of these.
Yes, so a high school student said, it's like a private place that you can share everything. And it's not only you, everybody sharing in there. Maybe they have been through the things you have been through or anything like that. It's how you kind of have similar things in common,
And then one parent said, my child is quiet, closed off, and doesn't share things with me so that he doesn't burden or bother me. But his heart was open with the school clinician, and he was able to help him and share with him advice.
And another high school student said, well, the best memory was making friends. Those friends became people I talked to on a daily basis. And the other thing that I liked about the program was the one in charge of the program. They communicate with us. They help us to go through things and activities. It was such a great experience for me. And I wish I could do it again. And if I could suggest people do it, I would recommend it for them. I learned and I would love to learn more.
Another parent shared talking about their child, that he could feel a bit more relaxed talking and sharing what he's feeling and how he felt coming here. That he was going to be with other children who went through a similar experience and that he wasn't the only one. So definitely feelings of connection here that they're sharing. And then we reviewed the qualitative data from these interviews, and we found some themes that our participants were sharing with us in their feedback. So overall, school is a really important place to support newcomer students and their families. So we'll talk more even about in COVID, but they also noted how helpful they were in just receiving resources and information. And it was also very helpful to learn about strong from trusted school personnel. So collaborating with the clinicians, with teachers is really important, as usually that's a trusted person for families. And then they really helped us make that bridge to know that we could be people they could trust as well. And overall, most of our families were saying, and our students, that we should offer this in more schools and really expand. And then we also got some feedback on how to improve this. So our families, particularly our parents, were really asking for more parent involvement, which is part of our original design, but due to the pandemic, we weren't able to do some of those parent meetings that we had planned for. But absolutely, that's something to keep in mind is our parents want more information and just some more involvement into what their kids are doing. And as we have learned throughout our whole experience with this language can be a barrier. And so when families don't have school personnel that can communicate to them in the language they speak, it's really hard to feel connected, and it just leads to more and more problems. And also our families were sharing there was concerns and some fears about sharing sensitive information with our research team. And so our team really took the time to explain how we can maintain all their information private. We did ask important sensitive information as newcomer status. So whether someone's an immigrant or a refugee, and understandably, many of our families were concerned about this. So we learned a lot. It's important to be very transparent and clear why we collect this information and what we do with it. We also got some more suggestions from our students and parents on Strong, and I'll let Rox start us.
Yes, so a high school student said, I highly recommend it to do it in other schools too. Maybe not in my school only, but expand the program in other schools because it could help other people. And I think because it would help them out to communicate and to express their stress, to share their problems to someone they can trust and help them to figure out better ways to handle things in life and help them go through their hard times and good times.
And the parents said if children are going to be in this for 6 months, that at least we meet once a month. So they tell us what's going on, how the child is progressing, and then the parent can see this progress at home in some way, but the person giving the lectures or the meetings can see how the child's progressing in a different way. So giving the pros and cons of what's going on, what we could do better or not, what we could change.
Another high school student said, I would just say you guys should really do this thing strong every year, not just next year or like you're working with other schools. It would help a lot of people, not just for this year. We had 5 people or something, but hopefully next year we can have 10 and then we can go to 15.
And then another parent said, I guess by having families and the students who already participated in the Strong program can set a good example. And they can say that I have gone through this. This was my experience. This program has helped me. It should not be something impacting them negatively. Like showing them this was affecting me, but I came out of it. And this is how I have got the help from the Strong program. We also got some feedback from our clinicians. Even though we weren't able to complete those clinician focus groups as intended, we still got very helpful feedback on their experience with implementation. So overall, they really enjoyed doing the using newcomer examples for the thought, feelings, and actions CBT triangle and making them more applicable for our students. Also, they liked the inside strengths and outside support session of Strong, that first one. And overall, they noted that this helped with connecting peers, the students to each other. So kind of creating peers and friends, and also to trusted adults. And that overall, they noticed that the kids were learning coping skills by participating in Strong. And I always like to say, just from 4 sessions max. So imagine full intervention. And then for suggestions for improvement, the clinicians noted that the manual in a way felt a bit restrictive as there are scripts provided in what to say for each section. And they noted that it was a lot of activities in each session in the time allotted. So typically an hour was put for the program. But when you think about school-based interventions, there's usually a lot going on. So fitting everything in at that 1 hour time point was challenging for some of our clinicians. And they also noticed it would be really helpful if there was more education provided for teachers and school personnel, such as administrators, about the purpose of Strong and why it's in that school in order to have more children identified and supported for the intervention. We, like I said, we also reviewed the COVID data from these qualitative Zoom interviews that we did with parents and students. And we asked how they were coping with COVID-19. And these are some of the things that our participants were sharing with us. There's definitely challenges with remote learning. So we started our first interviews of May 2020, so about a couple of months of remote schooling, and they were noted the challenges of that. So the technology with that, parents having to support their children with this change, and they may not be as familiar with Google Meets and things like that. There was also sick family members. So families were telling us how COVID had impacted their households and their extended family members and the stress and pain that caused. There was a lot of fear and uncertainty in this time that really created more conflict at home. And the isolation. So families were noting how difficult it was to be quarantined in the home and isolated from their community and neighborhood. There is also a lot of economic strain with loss of jobs and difficulty with basic needs. A lot of our families shared being in the service industry and how that impacted income. And overall, there was lack of resources and especially a lack of information in the language needed. So some of our families noted, even though some information was provided through the schools, that translation in Arabic or Urdu wasn't coming along right away. So there was delays in communication. But despite this, our families did note some of the ways that they remained resilient in this time. And they noted, even though this was really difficult, I was connecting with my family in my home in this time. And they also noted, the school still was really helpful and my primary source of support. So for some of our families, that may have been the weekly food pickup, daily food pickups that they could do, or even just getting information from school personnel and teachers about where to get more support. And here are some of our quotes from our students.
I'll read the first. This is from a parent. We were staying home. We were not sure we were still safe. And at some point we have to go out for sure for some essential needs. Going out and coming back home, still we don't know what's going on. Are we safe? It's all been the fear thing of this. We don't know what's going to happen.
And another parent noted, the second thing is the remote learning for my children. It was very hard dealing with them and convincing them with this new learning method. They were used to going to school and learn from the teacher. Here it was very hard for them. I face a huge difficulty because, as I told you, I don't know how to use computer programs and such things. We were able to overcome these difficulties together, and my older son helped me with his sister.
Another parent said, for me, the language, being able to help him because all the videos were in English. So I had to look up YouTube videos in Spanish to help him out.
Another parent said, paying the rent the first of the month was so hard because the financial help from unemployment was late. The owner of the house used to call me daily or to come over asking for the rent. He wasn't patient at all, which was really very hard for me.
And a student mentioned, it's been hard for me to get my grades up now. I think I failed 2 classes because I wasn't focused because there was a lot going on. And the social distancing learning was a little hard for me. Even if it's online and I can do it whenever I want, it's hard for me to understand the subject because teachers have office hours, but sometimes I'm not available because I have 8 classes I can't catch up on. And it's been really hard for me to do all my work.
So overall here, as you can see, how our parents were struggling with these challenges, but also our students too, and they were noting some of the academic impact of the stress. So we did review all this COVID data and analyzed it, and we were able to come up with some themes on this in which we were able to do a publication on this paper. So definitely there was a lot of challenges that our families were experiencing. A big part of that were these financial concerns. But they also noted that there were sources of support, such as through their school or their family, that help with their coping and adaptation. And what was very key for us as we were reviewing this data is that all these COVID challenges were compounded by immigrant stressors. So some of our families noted they don't qualify for government aid, and that was really hard for them to figure out how to take care of their basic needs. Or even the fear of some were experiencing as based on their immigrant or refugee status of how they would be treated in this time of the pandemic. So it was very clear that yes, we were all struggling during the pandemic and the quarantine, but there some of the identities of our participants that made it even more challenging for them to cope and go on each day. So what did we learn? And I feel like every day we learn more about Strong and how to support our families. Technology for us was a big learning experience in our transition to Zoom. It was hard for a lot of our families, and quite often we were, helping our families learn, how to download Zoom, and then talking to us on there. There's just variability in comfort and knowledge with technology among our families. And also that was noted in how difficult for some of them it was to support their kids in remote learning. Flexibility is always key. We always, as a research team, need to remain flexible to support our families, because even scheduling before the pandemic was quite difficult. But we roll with it just to account for family schedules, different night working shifts, so daytime versus nighttime, and trying to meet our families halfway as much as we can. And recognizing competing demands. So there were some families we really worked hard to try and enroll, but they had so much going on that it was hard for them to, even start with the program, and that was okay. For language, as incredible it has been to provide the service in 4 languages, we recognize it's not enough. And so for us, not having Hindi, Burmese was really hard for us to recognize, because there were families that we had to acknowledge we wouldn't be able to communicate with you, and that wouldn't be fair to you to give you material that you don't understand. So we need to continue working hard on how do we make our support and resources accessible in many languages to support more newcomer families. And overall, there's a need for resources that was really highlighted during COVID. So it is clear that schools and community-based organizations are trusted and are starting points of where to reach families. And that we need to make sure that we have information available in the languages, because some of our parents were noting that there was even increase in fear about COVID information because of the lack of materials available in their language to understand transmission. And also cultural humility. And I think this is something that we carry with us every single day, of just recognizing that migration and resettlement is not a homogeneous experience, and that all our families are unique in what they have come all to get to the point that they are here with us today. And so that has meant that that's why it's been key for us to make our eligibility criteria so inclusive, as we know that migration experience and how families understand their resettlement and how they need support is important. So for us, we were asking some of our families, even for example, we included Puerto Rican families in our in the intervention, but we spoke with them and they noted the resettlement to come to mainland was difficult. So yes, we do need this intervention. And this also led to us really updating our demographic information just to be more inclusive for our international participants. So overall, from our pilot year, despite its disruption, we definitely saw that there is feasibility. So how we were able to form these groups and also consent and assent all of our parents and students. And we did get a lot of positive feedback from our parents and students, even though there was this disruption and they didn't get the full intervention. And we got really helpful feedback from our clinicians on how we can improve for our next year.
That's right. And our lessons learned give us some hope for the future, and some hope that we can do the full intervention, as we saw great results the first time and we didn't finish the intervention. So we are planning to start Strong Cohort 2 this school year. We are right in the nitty-gritty of it right now, trying to get it started. Very excited about the process. And here are some of our research aims for the second cohort. Aim 1 is to evaluate the impact of Strong on student mental health via randomized waitlist control design, which is the gold standard of research. So we are very excited to have that different aspects this year and to really be able to evaluate differences between immediate and delayed group, which I'll talk a little bit more about. Aim 2 is to examine the impact of strong on resilience, coping, and school connectedness, and how these changes are related in turn to mental health outcomes in students. And aim 3 is to examine the implementation of strong across schools. So how's the administration receiving it? How's the teachers receiving it? And how the students are receiving it? All right, and then for our research overview, we do have a mixed method study similar to what we described in the pilot. So we are collecting quantitative and qualitative data as a form of questionnaires and interviews. And like I said, we have a randomized waitlist control design, meaning that there will be an immediate group and a delayed treatment group. So we have 3 time points of data collection, baseline, 3 months, and 6 months. For the immediate group, they'll start right after the baseline, and for the delayed group, they'll start three months after, and then we'll have a follow-up at 6 months. We are hoping that for this cohort to have 12 CPS schools to implement strong across 2 academic years. And we are hoping for 1 group per school, 4 to 8 students per group. We are still, again, in the nitty-gritty of group formation, so hoping that this is the case, and really working hard with our CPS clinicians and our partners to make this happen. And then at the end of the school year, we're planning to have a focus group with clinicians as well. All right, so this is our overview of our research design, just an overall timeline. At the top, we have the immediate group and the plan for the immediate group. At the bottom, we have the delayed group. So just to break it down a little bit more, at the beginning, we have, and this is where we are right now, the very first rectangle. Students will be identified, the consent process will happen, and the baseline surveys will happen. And then after the baseline is done, the immediate group will start their treatment, while the delayed group will be in their wait period. Then the immediate group will finish their group, do the post-strong surveys, they'll wait for a bit, and at 6 months, they'll do the follow-up surveys, while the delayed group will wait, they'll repeat the baseline survey at 3 months, they will start their group hopefully in March, and then at the end of the semester, they will do the post-strong survey. And we can see here in the next slide, more or less what our plans for the seasons are in terms of breakdown and what we hope will happen in terms of waitlist and delayed treatment groups. All right, and then for data collection, we hope to conduct surveys with parents and students, similar to what we did in the pilot. This baseline data will be collected in person, and the follow-up data per new CPS guidelines with parents will be conducted over phone or Zoom and in person with students. So in addition to surveys with parents and students, we are also going to get teacher reports on student functioning via the questionnaire, the SDQ, which is the Strengths and Difficulties questionnaire, which Sarah mentioned before as well. And we also plan to have focus group with clinicians to understand their experience implementing it and guiding the groups. And to talk a little bit more about some of our surveys, we have the Strengths and Difficulties questionnaire. This basically assesses mental health functioning and several problem subscales about emotional symptoms, conduct problems, peer problems, hyperactivity, and such. We also have a resilience scale to see how they are coping and how they do in the face of adversity. Coping efficacy, school connectedness, cultural or ethnic identity or pride, which is a new one we are implementing this year, and satisfaction at the end of the intervention. And student surveys will be done with students 11 years or older. For the parent questionnaires, we will be doing the RSQ, which is the responses to stress, to explore more how their children typically respond to stress or typically deal with problems. We're going to look at their coping efficacy as well in a parent report. we'll get demographic information from parents and also satisfaction at the end of the intervention. All right, and then for the clinicians, forms and surveys, we'll have the initial eligibility and child record forms, which is how the clinicians tell us what students they think would benefit from the program and what problems or areas they could use some help with, or they could strengthen their abilities in. And then we'll also get the SDQ, Strengths and Difficulties Questionnaires, the teacher version, which will be facilitated by clinicians, as well as session tracking, engagement forms, and satisfaction, just to see how implementation went overall. Then we'll have our focus groups and interviews at the end of all of the intervention. We'll have a facilitator or clinician focus group, again, to see how their groups went, and just to give them an open space to give us feedback for future implementation as well. We really want to hear their voices and consider what they have to say about this for the future. We'll also do a teacher interview with the teachers who did the referrals, because we will be relying on them to identify the students, and also we want to hear from them how acceptable strong was, how feasible it was from the teacher perspective. Again, we really want to highlight the voices of the people who are really deep in there actually implementing it. And the goals of the focus group and interviews is to examine the successes and challenges related to strong implementation, and again, explore recommendations for the future. All right, and the research prep for cohort 2 has many elements to it. It hasn't been a simple process, and we're still in this very not simple process. And the first step is coordinating with CPS and coordinating with all of our partners. Like Cate mentioned in the beginning, we have many partners, so there's many pieces that have to go into this. And we've worked really hard with CPS specifically to have them invested in our programs, and while our partners and our offices within CPS are supporting us, we obviously need to get buy-in from principals and from staff, from clinicians. So getting schools on board with an ongoing pandemic is not simple, but we are invested and we are dedicated and we are really hoping to make it happen. So hopeful for that to continue to work out. And we are seeing many schools being interested and involved in our training already with the clinicians. The clinicians are very excited and the administrators are also very excited. So that gives us hope. Another part to prep for cohort 2 is obviously to revise the measure translations, which is also a process that is complex and involves many moving pieces, but we are grateful for our team of RAs, research assistants, who are gifted in all of these languages, and we are very grateful for their supports in making sure that translations are accurate and understandable. Really, we don't want to use jargon or really complex language, so we want to make sure our translations are relevant to families and children as well. In addition to that, we've had to have an internal research training, so with our research team, making sure everybody knows all the moving pieces of this and is ready once implementation starts. And also we were part of training the clinicians in Strong. So we supported that process as well in a 2-day training that already occurred in this last month with CPS teachers, facilitators, clinicians, and administrators. All right, and talk a little bit more about the schools that we are hoping to have in our cohort 2 for the 2021 and 2022 school year. We are hoping to have 6 schools. We already have in the process of starting 2 elementary schools, 1 middle school, and 2 high schools. We are hoping for 1 more elementary school. And then for the next school year, based on this breakdown, it might change a little bit, but we're hoping for another 6 schools, 2 elementary, maybe 4 high schools. But this is pending to change. Just as long as we get our 12 schools, we will be happy. So these are some quotes that are giving us hope, and just keep in mind that these are some quotes from our pilot. These are quotes based on feedback that we got when we only did half of the sessions. So we're really imagining and hoping on what could happen if we deliver the full intervention. And that's really what's giving us strength and perseverance to keep on going, because research is very challenging. So this keeps us grounded. And a high school student said, I joined it, meaning strong, because I think it was a good experience and I wanted to try new things. It's such a great experience communicating with other people and what brought them around and what they went through and what they have achieved. There are other stories you learn from them, so I can become a better person in life. You can handle things friendly and figure out better ways to express our stress, like when we're stressed, when we're angry, when we're happy, when we're sad, to find someone to listen to us. We have any bad problems, so someone can hear us out and they give us suggestions on how to handle those kinds of things.
And then in our next quote here, we have a student and the student parents' perspective. And the student said, I have been really open to people recently. I've not been a really open person before, but after the program, I'm talking to people, asking for help and everything. And that parent said, I have seen changes, like he's more focused, staying positive, trying to get things done.
Yeah. And a parent of an elementary school student said, he's more expressive. He's sharing his views with other children and with his teachers more. Like I said, my child was a child that never said anything. And now that's not the case. He's able to speak up a bit more now.
And then elementary student told us, I did it because I had not been here for that long when I arrived at this school. I feel it helped me. It was supposed to help me. When I first got here, I didn't have many friends, but when I was there, or for the time I was there, I was motivated or taught to feel free.
Yeah, so these quotes really warm our hearts and give us hope that this intervention is positive, it's received well, and it's having some positive impacts on our youth and our families. So some of our hopes for cohort 2 is to deliver the full intervention, fingers crossed, in the middle of an ongoing pandemic, and just to see what that really could look like for Chicago public schools. Supporting our families and clinicians is another hope for cohort 2. Improving strong for to support future students and future implementation of strong, and build an evidence base for the dissemination of strong potentially. So we are really excited for what is to come, and we are really grateful for the time that you have all given us today to share our project and our excitement with you. We are open to questions and discussion. Thank you.
Great, thank you so much. So if anyone has any questions, please feel free to raise your hand or and unmute yourself and introduce yourself before you ask.
I have a question, if you don't mind. My name is Leah Romain. I'm an assistant clinical faculty member in the School of Education. This is so interesting. Thank you for sharing your work with us. I think my question is around any future work or hope for work that you might do with teachers in the schools. So that I'm just thinking about the fact that, you know, some of the stressors for these students are related to academics, obviously, and relationships they're forming with peers in the classrooms. And so while the intervention sounds powerful and amazing and supportive of them, I'm also thinking about how the school community can kind of rally around and understand these students better too, so that the school environment is less stressful for them. So I'm just wondering about your thoughts on that, if there's other things maybe coming down the pipeline, or what you're wondering about that.
That's an excellent question. Thank you. So we didn't mention this, but probably should have. So in between our pilot and our launch this year, our partners at the Center for Childhood Resilience at Lurie and us were brainstorming, like, what should we do last year? And we felt like we should pause strong because the schools were still so stressed. But one of the things we wanted to do while we were pausing strong was kind of build readiness of schools and kind of start to kind of think about like just raising awareness of newcomer strengths and challenges and how to support newcomers in the classroom. And so we actually did, well, CCR, Center for Childhood Resilience, led this effort, but they held a virtual professional development series on supporting newcomer youth in schools. And what's really great about that is the schools that got that last year are now partnering with us. Several of them are partnering with us this year. So we're hoping that that has increased kind of their readiness to adopt. And now they have teachers in their school that did this professional development series and now should know what strong is. And so some of that kind of early work that we ask clinicians sometimes to do has already been done. In addition, in Strong, there is a teacher education session that clinicians can offer. So there's flexibility around that depending on what's feasible for clinicians. But some clinicians have given it to, like, you know, if there's a school-wide meeting, like to all the teachers in their school. Others have just met with, like, you know, the EL coordinator and a few other teachers, and it's been much more small. But there is that piece built into Strong to try to do some of the work you're getting at.
Thanks, that's awesome.
Other questions? All right, I've got one. I'm just kind of curious. First of all, a great presentation, and much appreciate the presentation, and actually even more so the work behind all of this. You know, I, as the spouse of a CPS teacher, even I had forgotten that you were beginning in the middle of the strike. Wow, the hits just kept on coming there. I guess I'm kind of curious if you have any reflections of, you know, we can talk about the downside of going remotely, of obviously the downside of COVID on this sort of work. But I also think, I know in Curl's experience, we found some interesting unintended consequences on the positive side of, well, this allows us to reach out further or do things slightly different. Are there any sort of takeaways that, because you were forced to move and have some of that more in the data collection, but even if you've thought about it in terms of programming, of, well, wait a minute, it isn't all bad, the move to Zoom or Google Spaces, anything that kind of comes out as a, well, none of us planned it, but here we went through it, and here's something beneficial that we can kind of take away and perhaps add into the, either into the research and or the programming itself?
Yeah, I think that's another really good question. I think there's been pros and cons, and I'll say Sarah and Rox, feel free to jump in. But I think some of the pros of moving to Zoom or Google Meet is it does reduce some barriers. So we were with in-person meetings for parents. That's really hard. And we meet them at the school, like we try to make it as convenient as possible. But there's work schedules and childcare for younger siblings, and there's just a lot of stress on our family's shoulders. And to squeeze in an in-person appointment at the school with us to do a survey is often really tough. And so I think when we did our follow-ups, we got a pretty great response rate. It wasn't easy because I think now it might feel a little bit different because people have more familiarity, but we were literally trying to do the interview while teaching, like, how you might download Zoom or that you can call in with your phone. And so those kinds of challenges were still hard, but we got a really good response rate despite being in a pandemic. And I think that kind of meeting virtually does remove some of the more traditional barriers of transportation and time and you know, work schedules and childcare. So that's been a pro to kind of learn about that. I think another pro is that we have virtual guidelines for Strong now that we developed because, you know, we weren't ready for when the schools closed. We didn't have those guidelines, but we started developing them with the Strong developers once that happened, because we wanted to be able to offer clinicians something like, even if you just do some virtual check-ins and do some of the content, here's some virtual guidelines. So we now have those all ready in case in case CPS goes, remote or hybrid again. We're more prepared this time.
Okay, can I ask one more question?
Yeah,
Sorry.
go ahead. Otherwise, I was going to jump in, Leah. So please go ahead.
So I think obviously the response from the students is so positive, and they found the experience so valuable even after only 4 sessions. So I'm wondering if you're thinking about an opportunity for there to be some kind of strong alumni component, so that students, they're going to be your biggest cheerleaders for this program, obviously. So how are you going to capitalize on that and use them to foster support among students and maybe faculty at these schools?
That's a really great question. So we do have some ideas and early plans to kind of ask alumni of Strong, both parents and students, to help us engage families. We're still finalized. So some of the schools are the same from the pilot to this new launch, and some are actually new. So we're still kind of trying to finalize our school partners and then see what we could do. But both kids and parents told us they were willing to do that. So it's really, I think, an awesome opportunity, and would be really important, because there were questions and concerns at the beginning. And then once parents got a better sense of what it was, once students got a better sense of what it was, they wanted to advertise and help us. And so I think to be able to have someone who's already gone through that process helping kind of talk through any concerns or doubts would be really great. But we haven't formalized those plans yet. It's still in the works.
I'm going to put a link in. Unfortunately, it's not good news, and I don't mean to harsh anyone's mellow this morning, but this is the latest coming out in the news the last 24 hours from ProPublica about Heartland's struggle with their shelter. And it's, as I was reading it this morning, thinking about coming into this conversation, I was like, well, I don't think I need any further proof that these sort of interventions and this research needs to be done more. I know this is not a school-based situation, but given the state of the world, Lord knows there's going to be a need for more of these kinds of things, school-based and otherwise, which leads me to my question. Any application of Strong or something similar outside of that in after school programming or community-based programming?
Yes. I mean, Canada's always, a step ahead of us in terms of supporting refugee and immigrants. And so they have already moved during, it started, I think, this last year, not this year, the previous academic year, because they felt like schools were so stressed due to figuring out hybrid and remote learning and or returning in person, that they did move to some community implementation. So that is starting to happen too, which is really exciting. I'm always a big fan of school-based interventions because it makes it so accessible. Kids are there, right? They're in the school. But when our schools become so overburdened by something like, a worldwide pandemic, we have to, it's really tough to add more stress and more things for a school to manage. And so I think thinking creatively about other community implementation models that are still accessible is a really good move. And so they've been doing that in Ontario, and I know they're collecting data, but I haven't gotten a summary of their data yet.
Thanks. I know I'm kind of putting you on the spot with can't you do more?
I mean, we've also talked about, I think there's been some interesting models even here in Chicago of doing some implementation of interventions for immigrants and refugees in like faith-based settings, so like churches, other religious settings. And that's another place that I think could have a lot of, could be a really good idea for Chicago. And some of our refugee and immigrant communities really do gather and spend time with each other in faith-based spaces. And so that's another place that I think could be a really nice way to reach and provide accessibility and comfort, like accessing something in a place that's comfortable.
Teresa, any other questions from anybody else? Comments, hopes, fears, dreams?
Thank you so much. This has been an absolute pleasure to learn all about this morning. Yeah, we're so happy to have you, and we look forward to hearing what happens with round 2 here. And best of luck, and let us know if there's anything we can also do to continue to help support this and spread the good word.
Thank you very much. It was a pleasure to get to share our project with you all.
Thank you, everybody.